couple of words about Europe Park Federation. We are the largest network of protected areas, parks and reserves of Europe, and we count around 400 members, and we are represented in 38 countries. We are organized in national sections as well, or multi-country sections, to be closer to our geographical representation. And our headquarters is in Regensburg, but we also have an office in Barcelona and people working from the Netherlands and Italy. As I mentioned, you might see in the chat that we are collecting information, no personal information from our audience today, and we will share it at the end. So just to close my part before giving the word to our presenters. Peter O'Cliffe will give you an introduction to the webinar and which the main topics are, how the webinar is fitting in our work and agenda. And then our representative from Metsähallitus, Tina Hakarinen, is going to speak about their experience. After this, there will be the possibility to ask a question. You can write them in the chat and we will pick it up. And then it will be Neil Chalmers from Public Health Scotland. He's an health economist, and you will be able to ask him question too through the chat, and then there will be some conclusions. And I am, to be smart with the time, I'm giving the word to Peter O'Cliffe, our chair of Healthy Park, Healthy People Commission. Thank you. Over to you, Pete.
Thanks, Anna, and a warm welcome to everyone today. It's really great to see so much interest in this topic, really important topic, as Anna has said. Interest from across Europe and even beyond Europe today as well. So that's really good to see. Before we dive into the presentations, just a few words about the background to the Healthy Parks, Healthy People Europe programme. And I hope some of this will be familiar with you, familiar to at least some of you anyway. So in 2020, Europe Park Federation initiated its Healthy Parks, Healthy People programme with a post-COVID vision for a happier and healthier people, more connected to nature-rich parks and protected areas. To realise this aim, the programme identifies 4 pillars or principles: making the case, building partnerships, particularly with the health sector, but also other sectors too, developing capacity and practice in our teams and our staff and our organisations, and connecting and developing programmes which help to connect more people with nature, with a particular focus on health inequalities and health promotion. So definitely linking to the health world there. Today we're going to focus on the first of these pillars, making the case. We have the second slide. So there are several aspects to making the case that we explore in the Healthy Parks, Healthy People Europe toolkit, but today we're focusing on 2, and I've illustrated them here. What I call the nature is good medicine case, and the case around parks and protected areas being what we call natural health centres, complementing our conventional health centres, be they hospitals or GP practices, etc. The nature good medicine case is generally accepted, certainly in Scotland and the UK and other parts of Europe, partly because it's increasingly well evidence-based. And indeed, it's really difficult to keep track of the literature if you're not a frontline academic or a researcher in a public organisation. So we're not talking about that today. We're accepting that the case has been made around nature is good medicine. What we're exploring today is that sort of second case about how can parks and protected areas be natural health centres. Here this requires better quantification of the health benefits that parks and protected areas can provide to people who use them and enjoy them. And it also involves the use of the health economics, which is a specific discipline of economics, which determine what health treatment or public health programs are prioritized over others. Also important here is the concept of savings. For example, if we spend less on medicines because people are being prescribed health walks in national parks, there's potentially a triple win. Savings to health budget potentially, and even more money for other drugs or treatments which are coming on stream. Certainly a saving around less carbon and pollution from medicines production and use, and hopefully more investment in the parks and protected areas which provide these health interventions. So that's what we call the triple win. And we're looking to explore, I guess, that in that interface between the protected areas world and the health sector. Now, there are some big numbers around the role of parks and protected areas as natural health centres out there already. This quote and figure from a 2019 global study is the biggest I've come across. $19 trillion is the benefit or the economic value of the mental health benefits that protected areas globally provide. Now, that's a huge number. It's almost too big to be meaningful or trusted even. They're great, of course, because in economics, people like big numbers. But to influence health practice, we need to focus at the national and local scale on the smaller numbers, which can influence decisions on budgets and operations. So the first case study today looks at how this can be done nationally, drawing on the groundbreaking work of Parks and Wildlife Finland, using the Finnish National Park and Protected Areas system. And the second looks at work in Scotland that has a focus not on a park and a protected area per se, but the green space for hospital estate itself. But the interesting thing in this is not the setting itself, but understanding how the health sector values it and puts a price on it in health terms. So let's begin this exciting journey, because it is exciting and a bit scary, because we're going to do some health economics as part of it today, by heading to Finland. And I'm going to hand over to colleague Tina, who is on the commission, but today is speaking very much from a Parks and Wildlife Finland perspective. Over to you, Tina.
Thanks, Pete and Anna, and hello to all. Nice to see so much people online today. So I tried to share my screen, and I hope everything goes well, that you will see my presentation. So my name is Tiina Hakkarainen, and I work as a manager of corporate relations in Parks and Wildlife Finland. And my topic today is how nature pays back, how Finland's national parks improve public health and save money. And here you can see that Parks and Wildlife Finland, we manage all the government-owned protected areas of Finland, and we get our funding from the government of Finland. And with politics, you need to save money, and they are listening to you. It's not so easy if you only talk about nature and how it's important to protect nature and species, but you need to speak their language, and you need to always have good ways to explaining how your work is important, and you will get the money, especially at the moment when the money situation in Finland is quite tight, with all the public funding is very hard to get. So we have 41 national parks in Finland, then we have 19 nature parks and 1 UNESCO World Heritage Site. And then we also have 6 state-owned hiking areas, 1 hiking area which is established only by Metsähallitus. Then we have 12 wilderness areas and also over 3,000 conservation program areas. So we have quite much places where we need to take care of and what we need to manage. And here you can see only our national parks, and these numbers are basically what I tell you today. They are from our national parks. So 41 national parks, and we had 3.6 million visits to our national parks last year. So we have around 6 million people in Finland. So Finnish people, they truly love nature and national parks, and many of them come to see our beautiful sites when they spend their free time. So it's very good that a lot of Finnish people, they like to come to the national parks. And you can see here the how these numbers has been developing. So in these years 2021 and 2022 we had the coronavirus, and we had a lot of people then coming to the nature because people wasn't able to travel abroad or go to the gym or theater or concerts or anything, so everyone came to the nature. But we are still quite high level with our visits. The visitor number is more than we had before the coronavirus, so many people who started to come to the national parks before the corona time, they still are coming to see beautiful nature in our places. And what benefits does people get when they come to the national parks? So of course they will be hiking in very beautiful places, but we have made this study with this UKK Institute that they calculated that the government saved 164 millions per year when people come to our places, when they come hiking and have exercise there, and they spend their time in the nature, so they will feel better, and that saves money from the health care system of Finland. So that's the main thing that we are talking about today, but I also tell you a little bit about other numbers that we have in our national parks. So when people come to the national park, they normally go to the cafeteria or shop or spend night in the hotel. So they spend money when they come to the national park. And last year, when we had this 3.6 million visits to our national parks, the impact of visitor spending in nearby areas was 286 million last year. So that's quite much more than we have our funding every year. Is around 50 million what we get from the government. So that is how nature pays back to our society, that people spend money, and there are a lot of enterprises who work in our areas. And if you don't only count our national parks, but also the hiking areas and other protected areas, the amount of money that visitors spent the nearby areas was 412 million euros. So it was even more, but if you compare it to our funding, it's a lot. It's a big sum of money. And we have, of course, a lot of things that we need to take care of in our national parks. We have campfire sites, we have fireplaces, dry toilets, etc. So we need to have funding to take care of our places, that people can come there and have a nice time and visit there without damaging the nature. So that's why it's important to tell to the government that of course we need to have money. Of course the nature is there, but people can't come and have good and safe visits to our areas if we don't have money to manage our national parks. Here you can see one of our national parks, Liesjärvi National Park, and we have made a lot of trails there for disabled people. So we have this saying in Finland that nature belongs to everyone, and it's very important to have trails like this that you can come if you have small children, or you are older person and you don't have so strong legs anymore, or you need to use wheelchair or something. So we need to have different kind of services for people, that everyone can come to the nature. And here you can see how the visitors, the money that visitors spend in national parks has been developing during the years. Here's also you can see the corona years, which the amount of money was even more, but it has been growing all the time. So people, they like to sleep on the hotel. They don't like to so much to go hiking and then go to the tent for a night, but the Finnish people, they use more services when they come to the national parks nowadays than they used to, if you compare to like 10 years from this day. So people need more services, and they use money when they come to our areas. And when we go and talk to our politics, why we need to have funding to Parks and Wildlife Finland, we tell these magic numbers that how many millions people used money when they came to our areas, and how much government saved from the healthcare system when people come to our areas and move and they feel better, and how much we are like employing people, and how many cooperation companies we have throughout Finland, and how many people they employ. So this is the main slide that we use when we go to and talk to our politics about our funding. And then I still tell you a little bit more about this study that Metsähallitus made with the UKK Institute, how we calculated the benefits of outdoor activities for Finnish economy. So we did this calculation only once, and it was calculated in 2022. And the savings come that we reduce the chronic disease cost, and we improve workability of people and productivity of people who are in working life. So when people they come to national parks, their stress level is going down, and their blood pressure is going down, and they move a lot. They have physical exercise, and that is the reason how people can do better job when they go back to their offices, when they come to our national parks and spend time there. And in Finland, the UKK Institute had made before this study that how much physical activity people should have, and what kind of cost it does come if people don't move enough. And that is the main study that they used when they as a background information when they calculated this number, that how much our area save money from the healthcare system. And then of course they got our visitor data. So we have made these studies with our visitors, and we have the eco counters by our trails, so we know how many people are coming to each national park, and they compare it these numbers together, and this is like very cost effective way to move if we build trails and campfire site to the nature. If we like compare it to like other places like swimming halls or something, it's very expensive for the society to build that kind of places for sport if you compare it to national parks, where we only need like trails and parking plots and campfire sites and firewood and waste management. So it's so much so much cheaper for our society to take care of the national parks than do other kind of sport places. And as I said before, so we had this cuts to Parks and Wildlife Finland funding, and this is very important that we have these magic numbers to tell to the politics that we really it's a good investment for government to give money for us. And of course we need EU and state funding to maintaining our services. So these numbers we need to have when we go and talk to the politics. And then like this sports and sustainable tourism, it's very important to local economics. And of course it's like it supports the healthy lifestyle across all age of people. And we want to like integrate the nature in our health policy in Finland. We want to do cooperation with the health sector and tell to our our politics that national parks are like public health investment. And we are at the moment developing a little bit lighter method that we would be able to calculate every year the visitors spending money nearby our national parks, and also how much we save money from the healthcare system. So we are now doing the developing work how to do it in a more lighter way than we only have had resources to do this big study once with UKK Institute, but we hope that we will have a lighter method to do this in next years to come. And if you want to know more about it, I have been written this expert article to Europark website about this study, and there's also you can find the study about the cost of people not moving enough for their health from the UKK Institute from their website. So I have the links in here, and you will get the presentation material afterwards. But this was just a light, quick overview what we have done to help us to get funding to our managing our national parks.
Thanks, Tina. Fascinating stuff. Time for a few quick questions. I'm afraid Tina probably has to disappear, so we're going to take a few questions for her now. Lots of hands and hearts coming on screen. I guess the headline there for me was 1.6 billion or 1.64 million savings in 2022 calculated from this study, which is a really impressive figure. Anna, not sure I can see any questions coming, so I'm going to ask Tina one about, so you're going to redo the study, make it more light touch. How are you going to use those results? Is it just, and are you just speaking to the sort of environment part of the Finnish government, or how are you using this figure with the health part of the Finnish government?
So we used the numbers, of course, also with the media. So like the public opinion would be for our side, that people would feel that it's very good to like give funding to national parks and take care of the nature. And so that's one reason. But of course, the politics are the main, because we get main of our money directly from the government of Finland, and they decide it every year. So yeah, at least in tight money times, it's very important to have also that we can talk to their language. So,
okay, thank you. And got a few questions now, which we'll come to. I guess the other thing that jumped out for me was 3.6 million visitors to Finnish national parks. That's relatively low for some nations and for some protected areas. I think Loch Lomond and Sussex receives about 5 million visitors each year. So this is probably at the small end of savings if we want to sort of look at the, I guess, the bigger picture of protected areas, but also national systems as well. So really interesting. That figure looks big to me. So I can see some hands, but I can't see every hand. And I'm going to apologize if I mispronounce, but I have a colleague from the Swedish Centre with his hand up, Sandvik.
Yeah, hello. I don't know if you can hear me. Can you?
Yes.
Yeah, great. Swedish Center for Nature Interpretation. Thanks for the presentation, Tina. I'm curious to know if there are figures, statistics. What's the comparison between the advantages for health when it comes to protected nature and non-protected nature? Because I suppose that a lot of the Finnish people also go out in the other kind of nature.
Yeah, they actually have made some study in Finland about it, that when people come to the protected area, they get more of the health impacts, because if the biodiversity is more rich, you can get more health impacts from the nature. So I can like share the link about that study also. We haven't been doing any calculations how much we save more money when people come to our areas or to the like forestry forest, but they have made this study that the health impacts are like more relevant when people go to the protected areas, and they don't only be in one kind of forest where it's only pine trees or something like that, which is very very common in Finnish forestry forest.
I think it's a really interesting question. In some ways, the health sector doesn't care. They want to produce health outcomes, whether it be in a local green space or a national park. I guess what the Parks and Protected Areas system offers are places which can cope with that impact, and also staff and other resources which allow people to do more of that activity, etc. So I think I guess there's a whole spectrum. I do remember Finnish colleagues talking about a spectrum from local green space to the highest mountain or the deepest fjords. So I think it's a spectrum of approaches that we need to think about. And obviously today we're focusing a little bit more on the protected area bit of it. But got another couple of questions which I'll just quickly jump to. I think this is a colleague from Northumberland Wildlife Trust, so in England, I think that's right. But great that Wildlife Trust has joined Europark. So we're asking Tina about the sort of how do you get the economic data, and particularly the economic data from the wider area around the national park?
So we make studies with our visitors every 5 years where we ask them how much money did they spend in the national park and also with the nearby area. And in Finland, we don't have like so many. In some other countries, you might have like hotels in the national park or something. But in Finland, it's quite normal that only the government can own buildings in the national parks, and we don't have so much places where you can spend money just inside the national park, but nearby there are like restaurants and hotels and where people can go and leave their money. So we make these questionnaires every 5 years to our visitors in every national park. So there we get the amount of the money that they spent.
Thanks, Tina. And I'm going to pick up one final question from Roger here. So apologies for people I'm leaving behind, but hopefully we can address the other questions offline. So this is about how easy, difficult was it to gather the numbers, and are they contested or accepted by the broad public? And I guess the survey work that we do in the UK, both in Scotland and England and Wales, suggests that the public really get that nature is good for your health. Either because they've been doing it for a long time, or because they're new to the outdoors or new to nature, and they actually realize or recognize the health benefits that they get from that. So I think the challenge in there is not the sort of public acceptance of this. It's back to the hard choices that politicians have to make between budgets, and finding ways to communicate or make those choices more visible, I guess, to the public. We've had a really interesting debate in Scottish hospitals, which we'll come on to, about, I guess, nature-rich grounds, not doing amenity grassland, but producing meadows in our hospital sites. That's produced a really interesting discussion about what we really want is more car parks for our hospitals so we can get there. So I think we've got a long way to go with the public, but that sort of broad acceptance of the benefits of nature for people who've experienced it is definitely there in our survey world. Is there anything you want to add to that, Tina? And then we'll have to move on.
We also ask in our studies to our visitors that do they feel that they got like health impacts when they come to the national park, and they say yes, they do. Yes, they do. So we have been asking that also in our visitor studies. But thank you so much for listening to me, and you can send me also email or call me if you want to know more.
Thanks, Tina, and I appreciate you're going to disappear during the next presentation, so that's great. And apologies, we'll try and pick up some of those questions after the session, if that's okay. conscious of time, want to give Neil his slot now. So welcome to Neil. I think it's the first for Healthy Parks, Healthy People Europe. We have a colleague from the health sector to talk to us, so please be gentle to him. He's been Nature Scotland, Public Health Scotland have been working in partnership for a long time, but we're beginning to show some real tangible fruits in certain areas. One is around green health and social prescribing. The other one is around the use and value of the NHS estate. And we've been doing this really interesting bit of work, which Neil's fronted around, well, all public land managers should be looking after nature on their estate, and there's a whole range of natural capital benefits from that estate. But the health sector should be really interested in the health benefits of their estate. So this is a sort of bit of research which is trying to unpack that. It's about green space, it's not about protected areas, but hopefully the methodology that Public Health Scotland have been exploring here will interest you and be relevant to your park or protected area too. So over to Neil, and welcome.
Oh, thank you very much, and thank you very much for having me here today. My name is Neil Chalmers, and I've been working with Pete in Nature Scot, colleagues throughout NHS Scotland and Scottish Government, and also with our University of Aberdeen colleagues who really kind of led the work, particularly Luis Loriai-Rebeledo at the University of Aberdeen's Health Economics Research Unit. So the motivation behind this work arose from NHS Scotland's climate emergency and sustainability strategy. And this stipulated that basically we had to value the contributions of NHS green spaces to delivering climate sustainability and health outcomes. And the health outcomes is a particularly interesting area. So this had never been done before in Scotland. So this was certainly a kind of very interesting piece of work. And you might be thinking, why NHS, so National Health Service, I should say, in Scotland. So the acronym is NHSS. Open spaces, why focus on them? Well, you know, after hearing Tina's brilliant presentation and looking at kind of the parks in Finland, the actual open spaces that NHS Scotland has, these are hospitals, but also your general practice clinic as well, the space around there too. They're pretty large sites. In total, the NHS estate is about the size of the city of Stirling in central Scotland, and about half of the overall estate, covering about 825 hectares. That's almost twice the size of the Loch Lomond Nature Reserve Park, which Pete mentioned previously about how there's so many visits there. So it does also range in size between different regions of Scotland. Some health boards, so that's the kind of region tasked with delivery of healthcare, it can be quite small. In Shetland Islands in the north, it's about 24%, to larger areas, 63% of all NHS estate being in Fife. So there's a bit of variation in that area. So we first had to think about how to collect the data for this, and I will mention the methods in a moment, but I think it's important just to kind of highlight the kind of data that were used. And we used a cross-sectional survey of Scottish adults, and in total we had 2,449 adults. And we also drew questions from the Scotland's People in Nature survey, really to help us understand that our survey was getting similar results, which is what it did, to the SPAN survey. And we fielded our survey in October to November 2024. Before we did this, we did pre-test it with members of the public in what was called Think Aloud sessions. And we also needed to work with our colleagues at NHS Scotland to understand actually what the composition of NHS outdoor estates were. So we used GIS mapping for that to understand that area. And therefore, we wanted to ultimately understand what the health and well-being from exposure to nature in NHS outdoor estates was, as well as just the wider benefits from use of the estates to Scottish adults. So the first approach was to estimate values using what's called an exposure-based approach. Now, this is where it sounds quite arbitrary. You have to spend about 120 minutes or more per week in nature to lead to a health gain in QALYs. Now, this is the UK's Office of National Statistics, which recommend this time, and it's derived from White and colleagues' 2015 study. So a quality adjusted life year QALY, this is just a measure of basically the quantity of life, i.e. how long you live for, and the quality of life, basically. And it's aggregated into this metric. And so a health gain from exposure to nature of the NHS Scotland estate, this was estimated to be about 0.01995 QALY. So that sounds like quite a small value, but actually it's not when we think about it, because to provide one QALY, it's estimated that costs the NHS about £18,295. So to provide that kind of very small kind of number of QALYs, that's estimated to cost the NHS about £356. So if nature can provide that actually represents kind of a saving ultimately to the NHS, about £356 per that small number of QALYs. So that really does help to show that exposure to nature has a very kind of important consequence for financial sustainability of NHS Scotland. We also performed a contingent valuation, and this was where we asked respondents to state their willingness to pay for preserving and maintaining local NHS open spaces. We did this through a payment vehicle, and in this case, we asked them to think about a hypothetical levy on a council tax, that's a municipality tax that every adult in Scotland or every household has to pay. So the idea behind this is that we wanted realistic values. If people are basing willingness to pay on what they are actually able to pay, then it's much more realistic than just say name any amount. So that was quite important to get that correct. And just the kind of visit characteristic results we got from the survey, well, 53% of adults in Scotland, we estimated, have spent time in open space in the last 12 months. And that's, most of the visits were under 1 hour long, which maybe isn't that surprising. But when you think about the National Health Service in Scotland, that's obviously primary care and secondary care. So, just visiting your general practitioner, if they have green space or open space, you're going to be walking past there. So that does help to kind of realize why that figure sounds quite high. And the main reasons that people stated in the survey of visiting these sites were using them for walking and relaxing. And actually, we got a very high figure of about 84% rated the spaces as being of good or very good quality. And a high figure was reported for helping people to de-stress, relax, and unwind using these spaces. So the main characteristics of use tended to be males, younger age, those in higher income. Obviously unsurprising, I should say, that those without a private garden, so typically they would be using the space, those living close to the space. And perhaps on the inequality side, actually those living with physical disabilities and mental health conditions were more likely to use these spaces. So that's certainly a really helpful result for our health boards and actually understanding what people are using the spaces for. Overall, per year, we estimated that it was about 128 million annual visits, which sounds a lot, but when you consider that if people are visiting on almost a daily basis, if they live near an NHS estate, it does actually kind of put that into some context. You'll notice that actually the 120 minutes, that was actually a fairly kind of low figure. So obviously conscious that to gain any QALYs, you have to spend a minimum of 120 minutes within the NHS Scotland estate. So to think of the direct health benefits, that's only about 5.1% of the population are spending 120 minutes or more. So that's kind of, in some ways, that does maybe underestimate our overall kind of QALYs gained from these spaces. I won't say too much about the attributable health benefits, because these are where we looked at those who haven't quite spent 120 minutes in NHS Scotland estates, but have likely spent it in nature and other areas. And we were able to ascertain that from the survey questions. So we'll just focus on the direct health benefits, which I think is most useful. But ultimately, this could represent £82 million of avoided NHS spending, because we know that spending now that time on an NHS estate is giving health and well-being benefits through that kind of 0.002 QALYs gained. And ultimately, at population level, that would represent 4,595 QALYs gained. So this is really helpful for now saying and justifying, I think that's the important thing, justifying having these estates, because they are delivering health benefits. Importantly, most of the kind of direct health benefits came from primary care sites, which were typically much smaller kind of green spaces compared to the kind of hospitals, which had much larger green spaces. So that also shows that it's not about size. It's really about kind of the quality of the site, and actually the users gained kind of a lot of health benefits from just simply being able to go into a small area of land when, say, visiting their general practitioner, or just walking through it anyway. They don't have to be using an NHS health facility to gain that. And then finally, the contingent valuation. This is where we ask people to state their willingness to pay for the sites. And we found a higher willingness to pay for primary care sites than hospital sites. So again, people do really value having those kind of often smaller open spaces in their primary care site, general practitioner, than a hospital site. So that also helps to kind of complement the previous results, which showed the kind of QALYs gained from having provision of NHS open spaces, but particularly primary care spaces. So just to kind of summarize, I think NHS open spaces, they can help realise health benefits within communities, but we do have some inequalities of access, particularly females and older people are less likely to use these spaces. So there are kind of issues there. We also have to say the current Office for National Statistics guidelines essentially only break down by habitat. So if we could explore the specific direct and attributional values of specific typologies, so actually maybe we could see more of what it is about these spaces that people like. Is it the kind of having lots of forest or having lots of trees in, say, hospital sites versus having wildflowers in more primary care sites? Is there something there that could answer that? So that would be something that would be worth exploring in future. Just to go over the strengths and limitations, this is the first known application of this. Actually, I was saying Scotland, but it is actually in the world. We're quite ambitious in our approach here. We also were able to tailor the survey to its policy relevant. It's definitely got adaptability to other health and care services throughout the world. We would hope maybe colleagues listening to this who maybe have links to health services in their own countries might be interested in this particular type of work. But there are kind of limitations. There's certainly kind of within the exposure-based approach, as I said, that 120 minutes threshold, it certainly likely kind of underestimates the overall benefits in terms of that £82 million in NHS kind of essentially savings. There's also potentially a hypothetical bias in the willingness to pay of the contingent valuation method too, despite we tried to use that payment vehicle of a council tax levy. It's still, when people aren't using their own money, there is always that potential issue that people are saying, well, we really have this high willingness to pay for this primary care site, but obviously if they're not actually paying the money themselves, there is always that potential issue. So I think that's my 20 minutes up. Just to acknowledge some more colleagues here. Of course, Louise, brilliant. But also my colleagues, Jodie Dean, Andrew Garozowski, Ivan Clark, Nature Scott, obviously Pete Rockcliffe, who's here, Nature Scott, Charles Bestwick, Michelle Wilson, and Ian McKenzie too. So thank you very much for listening, and I look forward to any questions you may have. Thank you.
Thanks, Neil. I guess anyone who has done economics in the last 30 years will have encountered contingent valuation methods and their pros and cons. So it's as I say, has some strengths, has some limitations, but and you need to have your eyes open. But really interesting piece of work, Neil. So we've got a couple of questions, I think, already, but put them in the chat, put your hand up again. So is the government using these savings on health? Does the health system get less funding? Does more money go into green areas, or savings are applied elsewhere? I guess that's really tricky to answer. In general terms, I guess the whole thrust of a strategy that Neil put up on slides at the beginning is a strong policy commitment to looking after the NHS estate for delivering health, but also for delivering nature and climate adaptation and resilience as well, and also for community benefit. Many of these hospital sites are in more disadvantaged urban areas. So there's a really strong policy push in those directions, and there is money available for improving the NHS green space. Now, what happens on the ground is sometimes different, of course, because individual estates will make different decisions. So it's all work in progress. So there's some benefits. There's some things really good happening on the NHS estate and some less good things happening on the NHS estate too. This is really important bit of research because it actually allows the NHS to think about the value of these green spaces. So when they're thinking about do we put a car park in, or do we put a bit of green space, or improve the nature on this bit of green space, they can make better judgments, better decisions. But it doesn't mean they'll choose the green space over a car park sometimes. Neil, do you want to add to that? That you're obviously in that world, in that fight.
No, I think that's perfectly summarised, Pete. I think it's always difficult having that discussion about savings because there's always that kind of, some economists are very anxious about using the term savings because obviously any money released from having provision of, say, outdoor estates will immediately be used for something else within the health service. So there is it is that kind of nuance, but ultimately I think having outdoor estates where we can now say does deliver a health benefit and we've got a quantifiable value on that, I think makes a very strong argument of improving and maintaining the sites. So I think the fact that £82 million of resources, which is likely to be an underestimate, can be realised from saving those resources from provision of these outdoor estates, I think is a really good starting block. But yeah, I can't really add much more to kind of Pete's really excellent summary there.
Thanks, Neil. Another question here about qualitative data as well as quantitative, and definitely there's value in the qualitative as much as the quantitative. We're very interested in Nature Scott about storytelling and narratives, but actually they're the things which really, dare I say, they're the things which really make decision makers think as much, if not more so, than the numbers and the data sometimes. Even though we like to pretend we're evidence-based, it's important, but it's not the whole picture. So there has been work done on this. We've got some fantastic videos from an NHS Green Space demonstration project, which provides some of that qualitative stuff. And although Neil didn't say it, there's another phase of this research which is going to be looking at staff in particular. So the NHS, rather like Tina picked up, the NHS is a large employer. Its sick absency levels are pretty high. Not surprisingly, it's a stressful environment. It's a hard environment to operate in. And the value of these what we've seen from the qualitative stuff is the value of these green spaces is really high for staff, even if they don't do 2 hours, even if they do 10 minutes during their busy day. And one of the interesting sites in Glasgow, new hospital site, we've put in a garden, structured garden with raised beds and shelters, etc. And the NHS, the feedback we get from nurses in particular is that they love to go there with their patients, but they also love to go there themselves because it's just outside pager range. So they can have 10 minutes of uninterrupted relaxation in nature, and they really value that. So really important, that qualitative side too. One question about, I think, from Leon that I spotted about, this is a national survey, so does it say anything about more rural or remote parts of Scotland? And obviously we've got a huge concentration of people in central Scotland and then quite fragile and remote areas and islands in the north and west and the south and west in particular. So Neil, is there anything to say about the sort of rural dimension here?
Yeah, I mean, firstly, yes, it obviously covers all health boards in Scotland, so very much the kind of the islands and also the Highlands and also kind of northeast of the country. The kind of, I suppose, the provision of kind of outdoor estates differs within kind of each health board. So we can have a very rural health board like Shetland, as I mentioned, which doesn't actually provide that much in terms of outdoor estates. I think I would need to dig out the kind of numbers in terms of looking at kind of each health board in particular. But it obviously the bulk of the population do live in central Scotland, so that there's just going to be that kind of slight kind of bias in terms of that's where kind of a lot of the population health benefits, i.e. inequalities, are gained from. But yeah, I would have to kind of look out the kind of, it's not in our report, but we do actually have that data. So if you want, I can put my email address into the chat. Maybe you could email me the person who had that question. Yeah, I can certainly provide that information for you.
Good stuff. And I guess it gets into a really interesting discussion about the connection between the NHS estate and the wider green space and the wider nature. I think colleagues in Shetland would say they have most of their villages and settlements are on the coast. So actually the provision of green space, blue space, is largely outside the estate, but it still contributes to the sort of health benefits that people get. So really interesting, sort of back to that spectrum of nature within managed places and within wider countryside and coast as well. Right, I'm afraid we're just about out of time, so I'm not going to try and conclude the discussion, apart from to say thank you for Tina and Neil for the excellent presentations. Making the case is one of those 4 pillars, and we need to be better and more articulate and invest some time in that. And hopefully the 2 presentations today you can take away and think about and work out how useful they are in your context, whether it be a park or protected area or health sector or national or local government. So really really interesting and stimulating stuff, I hope. I'm going to briefly hand back to Anna, who has some Europark announcements, but really, but also HPHPe announcements as well. So over to you, Anna.
Thank you for your participation, and thanks for our speaker. It has been a very, very good session, very, very rich. We are going to share, as I said, the outcomes, and also pick up the unanswered questions so that you will get something in writing. My main announcement is that we recently opened a public LinkedIn group with Healthy Park, Healthy People. You will receive in the outcomes also in writing how you can access it. And we welcome you to join and to share your experiences. We are going to post twice a week. And we hope that we will get even a more vibrant community than we already are. And if you want to get engaged with Healthy Park, Healthy People, we are very keen to get information from you. You can write an email to me, and we will send you some extra information or get some information from you, so we can actually either support you and or promote the work you are doing in protected areas in your constituencies. And that's all for me now. Yes, there is a feedback form that we are sharing. Thank you.
Thanks all. Have a great day.